Traditionally, services have been organised according to professional disciplines, departments, particular programmes to deal with a particular issue. That traditional way of organising services is broken. It's not delivering the outcomes we want. Public service reform is about starting with people, their needs, their families, the places they live, and organising services around them in order to meet their needs across traditional boundaries, across traditional professional skill sets, a team of people working together to get the right outcomes.
People actually relate very much to their own local neighbourhood, and particularly when we've looked at some of the families and individuals who put most burden on the public services, what is really striking is they're very related to place. They tend to stay in the same neighbourhood, mix with the same people, have this, very local relationships, and therefore it's crucial that the public service moves out of its organisational silos and organises itself around place, and organises in a way which engages with local people and helps them to solve their local problems.
It involves housing, education, improving education, worklessness, reducing antisocial behaviour and crime and disorder.
Through my time of getting sent to all different services and then them still saying you're the problem, by the time you get to another professional, you've got to repeat everything again. So it's one person who just is on the ball and can't let anything slip. It's better than having loads of different people. Things are changing, it's getting better now. The house is getting a bit calmer and people are starting to see it's not you, that your child has actually got a problem that he can't help. It's going to be a lot better than where, like even a year ago, where I was, a million times better from where I was.
What we've managed to do, I think, in Greater Manchester, and this is really only over the last 3 or 4 years, is to develop an understanding of how we need to do different things at a different spatial level, but occasionally you need the scale of the bigger place to have the commissioning capacity to do things at a more local level. I think probably a very good example of that is the early years new delivery model, where we were able to pilot a number of different approaches in different parts of the conurbation. Through that, to be able to assess what works, to develop a consistent new delivery model across the whole of the conurbation, but for that still be delivered at a neighbourhood level and have all the variations that are required in different neighbourhoods.
There are lots of benefits to the children being school ready in regards to their learning ability. The children will be able to access the learning that much easier. They'll know the vocabulary that we're using, or they'll be more ready to take on that new vocabulary. Also, the children tend to be very motivated to go and to access the materials and to learn for themselves. They're very highly engaged, and they're also likely to cooperate with simple rules and simple instructions. The children will be more likely to have better relationships both with their peers and with the adults in the setting as well.
This is a great time for Greater Manchester. We've got the opportunity to make the greatest and fastest possible improvement to the health and wellbeing of the population, of the 2.8 million population of Greater Manchester. That's the aim of the agreement that we've struck with government and with all the different organisations in Greater Manchester, and that's our ambition. It's a good time because I think we can see that the model of government controlling everything and us in the regions just receiving money and receiving diktats about how things should work just isn't working for local areas. So what this is about, it's about us saying we think we could do a really good job in Greater Manchester running the health and social care system, and that's what we want to do. And why Greater Manchester? I think because we've shown that we can work together within Greater Manchester. So the NHS has shown that through programmes such as Healthier Together. The councils obviously have shown that over many years, and now with the partnership with NHS England and the Department of Health, we've shown that we can work positively with national bodies as well. So I think it's that strength in our determination and our collaboration that really sets us apart at the moment.
Well, before I had the team coming to my home, it meant I would have to go into the hospital to have treatment, in which case I would have been in there each time for around about 2 weeks. So that would have been in all at least 6 weeks. Because I have it at home now, it means that I can get on with my day-to-day life in general and run things as if it was quite normal. You can go out, you can do your shopping, you can have friends, you can even go on social evenings if you wish.
Access to general practice is a big concern of the population, and politicians have emphasised that. We also need to improve, secondly, joined up care in the community, so district nurses, social workers, pharmacists, working together around and with patients who need their care and support. And it's also about hospital care. And what we realised, working from the NHS, is that we can't just propose changes to hospitals unless we can demonstrate improvements in primary, community and joined up care as well.
My quality of life has certainly improved with the team, because it has given me that independence that you don't have in hospital, and it's given me, the sense of security of being at home and the comfort of being at home while I'm being treated.
There's an absolutely shared understanding that whatever other issues we're dealing with, it is the economic prosperity of Greater Manchester. It is dealing with fundamental issues of worklessness. No matter what agency you work for, whether it's the police, the health service or whatever, that is our priority, because everything else flows from that. And I think that's that very strong vision, which then produces very strong joint working, I think is what marks us out from other places that I've served in.
We've had deeply entrenched deprivation in some parts of this city for decades. I think we know from the new ways we're working now that first time we've got the techniques to really break into that, to start breaking cycles of deprivation, breaking cycles of poverty, and give everybody within the city region hope. Vision for Greater Manchester, it is about being healthier, it's about being happier, it's about being better educated, about feeling safer. It is about having a place where people make choices to live here, to work here, to have businesses here, to bring up families here, that they don't really want to be anywhere else.